So that someone like a weightlifter, a bodybuilder, okay, they could take anabolic hormones and build more muscle. Muscle is made up of mostly proteins, your actin and your myosin. Now, they're also going to impact, growth hormones are also going to impact the skeletal system, cartilage and bone. Back in the day when we talked about connective tissue, we said that connective tissue is made up of cells and extracellular matrix, and that extracellular matrix has both ground substance and fibers. And a part of that ground substance is a complex organic molecule called a GAG, glucosamine glycan. And one of the primary GAGs that we find in cartilage is called chondroitin sulfate. Okay. It's a big component of the extracellular matrix, the ground substance of cartilage and bone. So growth hormone is going to stimulate uptake of sulfa, which is needed for production of chondroitin sulfate, so that you can produce cartilage, which in turn, in many cases, gets converted to bone, because a lot of bone grows via endochondral ossification, where you take a cartilaginous matrix and you convert it to bone. Okay? So we can build muscle, we can build cartilage, and in fact bone with growth hormone. It has some diabetogenic effects. This kind of means anti-insulin effects. You know, insulin lowers your blood glucose. Growth hormone is glucogenic. It increases glucose levels within the blood. Okay. Let's start with number 2. In the liver, it stimulates glycogenolysis. Remember, glycogen is a storage form of glucose. It's where we take glucose and we add the glucose subunits to form a bigger molecule, a polymer. Well, under the influence of growth hormone, that glycogen is broken down, and glucose is released into the bloodstream. Okay? And we also mobilize fats. This is an anti-insulin effect. If insulin is present in the blood, that inhibits the breakdown of triglycerides. Okay? Whereas growth hormone, which has anti-insulin effects, is going to trigger the breakdown of triglycerides. So they're broken down into fats, which can be used as an alternative source of fuel, which by conserving glucose allows glucose levels to decline. All right, so how do these effects occur? Well, some of these effects occur in response to the generation of these intermediates. These are called insulin-like growth factors produced by the liver and a few other tissues. So when growth hormone reaches the liver, it triggers production of these growth factors, which in turn impact skeletal tissues, bone and cartilage, other tissues. So it has extracellular effects, causing increased cell production, growth. Okay. We also said that it's going to have some other more direct effects, some anti-insulin effects, okay, which impact carbohydrate metabolism and fat. Causes the breakdown of glycogen, which is the opposite of what would occur with insulin, and the breakdown of fat. We call that lipolysis. And these two people here that we're looking at now both have problems with growth hormone. Some of the most interesting patients you will ever see have endocrine disorders. They tend to stand out, as these two people do. Many times, they're employed. Many times, because of their unique physical features, okay, they're hired by like a show like Cirque du Soleil, or by a circus, or whatever. So this guy would be the giant in the circus. He would be a pituitary giant, whereas the little fellow would be a pituitary dwarf. In one case, excessive production of growth hormone. In the other case, insufficient production of growth hormone. When I was a kid, you may have heard the story. I remember seeing The Wizard of Oz at age of 3. And the little people scared me to death. And it wasn't just the little people, it was the monkey men also. But it was frightening. And for some reason that kind of created a little mental scar. Not that it should have, but I'm just being honest. And so I think that shows like The Little Couple and Big People in the World and The Little Family, all these shows that are on Channel 5, they're actually good. Because what they tell you is that these little people are not bad people. They're just like you and I. You know, it's interesting, like when, like the doctor, they built their house, they built everything so that it would accommodate them. You know, all the surfaces were low and things like that. But all their problems are just the same problems that you and I have. So in a way, I think that those shows are very interesting. It's interesting how do people respond to them when children see them. There's an immediate response. And I can understand that, because I know when I saw the little people on The Wizard of Oz, it was terrifying. I don't know why. That was just the situation. You know, it was just out of the normal. And so I think people with endocrine disorders oftentimes are striking. You see something right away that's different, okay? And of course, as adults, we try to hide that reaction. Children, less so. So if I had to be a dwarf, though, then there's lots of different types of dwarfism, but if you had to pick one form, you'd want to be a pituitary dwarf. Why do I say that?
Because they're more proportionate.
They're proportionate, right. They don't have near the medical problems. They don't require near the number of surgeries that somebody who was an achondroplastic dwarf, for instance, where their limbs are foreshortened and they have all the joint problems, back, spine problems. They don't have that. And so if you had to pick one form of dwarfism, I think that's the nicest form. You know, you see these little bitty kids with these primordial dwarfs, they have lots of problems. They're very fragile, okay? They have social issues. This is the type you want to be. Okay? Now, let me speak a little bit about growth hormone. We said that growth hormone is necessary for growth of cartilage, skeleton, so it plays an important role early on in life, for early childhood development and adolescence. But it also plays a permissive role. No, I'll come back to that. No, negative. So it plays an important role early on, okay, in terms of growth of cartilage and the skeleton. So that early on, if you're lacking it, okay, you're not going to develop as normally. Now, in the United States, do we see pituitary dwarfs as frequently as we used to? No, and there's a lot of reasons for it. Back in the 80s, late 70s, early 80s, growth hormone from the human body was isolated, and then we could reproduce it. We could synthesize it exogenously. So that gave us the ability ultimately to inject children who are falling behind, who maybe didn't have adequate levels of growth hormone, so that they could catch up with their peers. You know, now when you have a baby, you take them for well baby checks, where every 3 months or so, they're going to measure the height and the weight of the child. And if that child begins to fall behind by 2 standard deviations or more, you know, their peers, then that child's going to be referred to a pediatric endocrinologist, and they'll be evaluated for injections with growth hormone. So you don't see pituitary dwarfs as often.
So, I mean, could it be as young as like 6 months that they would notice, or do you think
they would notice earlier, because as soon as that child is born, they're measuring.
Right.
So it would be noticed early on. Now, the most common cause of pituitary gigantism is what's called pituitary adenoma. There's lots of terms for tumors and cancers, malignancies. When you take histology, you'll learn that these terms that are used, like carcinoma, adenoma, adenocarcinoma, sarcoma, it depends upon the tissue of origin. Okay? So if you have a tumor, and you see right here within the pituitary, that's derived from glandular epithelium, and it's not malignant, meaning the cells aren't going to break loose and metastasize. Instead, it's benign. It's a benign tumor. We would call it an adenoma. Now, these cells of the adenoma are going to divide at an accelerated rate, and they're going to produce secretions, hormones that are released into the bloodstream. But the cells aren't going to detach and spread elsewhere. Can it kill you? Yeah, well, if you let an adenoma continue to grow, your intracranial pressure is going to climb, and it can have adverse effects. But it's not going to metastasize. Are adenomas common? Yes. We are now. I'll tell you, there are 3 people at this school who have had pituitary adenomas. And one of them is open about it, so I can say her name. It's Miss Diana. Yeah, she's had hers removed though.
How do you know about the others if they aren't open about it?
Because students come and talk to you about it. When they go to get surgery, they want to know about it. What do you think? You know, that's what happens. So, gigantism occurs when you have a growth hormone secreting. Pituitary adenoma, but it has to develop before the epiphyseal plates have closed. Okay, so really before adulthood. Yeah. So that excess growth hormone is going to stimulate growth of cartilage, for instance, within the epiphyseal plates, and that in turn is going to stimulate longitudinal growth of bones. So that's why this person gives a result. Oftentimes these people can climb to heights near 8 feet or sometimes above 8 feet. Now, not every tall person is a pituitary giant. Shaquille O'Neal, Yao Ming, are they pituitary giants? No. They're tall, but their parents were tall. Yao Ming's parents both played basketball. Okay. Andre the Giant, who was a wrestler, was a true giant. You know, when you look at him, even like Hulk Hogan would pale in comparison in terms of his size. Andre the Giant was super, and he was abnormally strong. Most of these pituitary giants, by the way, don't have a normal lifespan. Oftentimes they develop cardiomyopathies in their 40s and 50s that kills them. This person has a different problem. Well, it's different and it's the same. This person has a growth hormone secreting pituitary adenoma, but it developed after his epiphyseal plates had already closed. So now that excess growth hormone can stimulate growth of bone, but only appositional growth, growth in width, but not endochondral growth, longitudinal growth, because those plates have already calcified. So if you, they always, when someone has this condition, it's called acromegaly. And acromegaly literally means enlargement of the acral or distal parts, the parts that stick out, the head, the feet, the hands. That's the most obvious changes. Their bones grow in width, but not in length. And so they always show the hands in the pictures. If someone's taking a picture and they're doing this, right away you know the diagnosis. It's acromegaly. Mm-hmm. The hands are oftentimes described as spade-like. In other words, all the bones are wider. The fingers look more stubby because of the appositional growth. It affects the flat bones of the skull. They expand. So it gives broader features. The forehead looks broader. The mandible can be more prominent and jut a little bit more than normal. It can affect the soft tissue. So you notice the nose will widen. Their features will not be quite as refined. With regard to their shoe size will increase. They'll go from a normal to a double wide or whatever it is. Okay. So this is kind of the look, and what's interesting is some of the ladies, and I can't speak for you, Jordan, but I have a feeling that you like this look. It's kind of more a primitive look, kind of a He-Man kind of thing.
Yeah, definitely.
Okay? Yes.
Can an acromegaly be a result of a traumatic brain injury?
Usually not.
Okay. But we had a patient that
Let me say this, I'm not saying it can't, but that's certainly not the common scenario. So what happened?
well, I don't remember exactly what happened, but I know he had like a moderate to severe brain injury, and it's the only case where like the doctor that I work for said that like there were actual proven like medical records that his like feet and hands and stuff started to grow after he acquired the brain injury. But I don't remember seeing that diagnosis in his medical records.
Yeah, usually what happens is when you have brain injury, there's necrosis of tissue, there's loss of tissue.
Right.
So you can, for instance, destroy part of your pituitary because of injury or ischemia. But it's interesting, yeah, so I'm not saying it can't happen, but it can't be common.
Okay, right. I was just wondering, I mean, I'm sure there are other causes, but it was just an interesting.
Oh, no, that's interesting. Barry Bonds. Have you all heard of Barry Bonds? Famous baseball player. The reason he was suspected of using artificial growth hormone is because his head was getting bigger. Not only his head, but his entire body. If you looked at his rookie baseball card, he was kind of a thin, muscular, but, more, what's the term, svelte? Is that the word? But now, 7, 8, 10 years later, this guy has become massive. His head has become much larger. Okay? So, back in the day, long before we had CT scans or MRIs, people wore hats. I think we've talked about this before in AP1. And so people would go into the physician and say, listen, my hat no longer fits. Okay? And the only way they had to truly diagnose it was by plain films in the skull. And so you would look at a mid-sagittal section, let's say, of the skull, or lateral projection of the skull, and you'd be able to see the sella turcica, and you'd be able to see the anterior and posterior walls being eroded, and the sella turcica expanding because of the tumor. Well, to pick it up at that point is relatively late. Nowadays, we have MRIs where we can pick it up in the very earliest of stages, at a point where it's called a microadenoma.